All right, hey everyone. So I want to go over here some of the muscles in our cervical region, so some of the muscles in our neck. And in particular here, I want to go over what are sometimes referred to as our strap muscles, also called your infrahyoid muscles, right? So just for reference here, you can see some muscles on the face. You can see clavicle down here that I just highlighted in blue, so here on the left side. So if we rotate the body in this direction here, and we start to look on the inferior side of the mandible, this is going to be kind of in the region that we're looking at, right? So there are some superficial muscles that we have to remove in order to then see these infrahyoid muscles. And two of these muscles that we have to remove, so we'll dissect out here, are the platysma and the sternocleidomastoid, right? So for on our left side here, we'll focus on the left. This is our platysma, right? So that broad kind of sheet-like muscle, very, very thin muscle of facial expression. We're going to hide that one. And then you'll also see the sternocleidomastoid right here, right? So again, we're focusing just here on the left. So we'll remove both of these. And by removing these, it exposes some of these deeper muscles in our cervical region, which again are our infrahyoid muscles, sometimes called our strap muscles, right? So again, if we kind of rotate the body in this direction here, we can see some of these. So if I zoom in here, just for reference, we can see, again, clavicle here, and then sternum here in the midline. This is our trachea here, all of these things for reference. So first large muscle that we see here, and you'll notice that with these muscles, before I tell you their name, the names of the muscles tell you something about where they attach, right? So where these muscles attach. And so three main regions that we'll see are the sternum, the hyoid bone, which is this bone here in blue, and then the thyroid cartilage, which the thyroid cartilage is right here in blue, right? So sternum, thyroid, and hyoid are the main ones, right? So this first muscle here is this one that we're going to highlight in blue. This is called the sternohyoid muscle, right? Sternohyoid. So based simply on its name, you can probably guess as to what it attaches to. It attaches to the sternum, so kind of the deep surface of the manubrium. So if I highlight it here, or if I isolate it rather, you see that it's located on the deep surface of the manubrium, right? So here's our manubrium here, and you notice that it's just on the deep surface of that. So that's its inferior attachment, and then its more superior attachment is up here on the hyoid bone, right? So hence its name, sternohyoid, right? So that is one of our infrahyoid muscles. And again, if you just go based on the name, you know where it's at, right? If we dissect this one out, right? So we're going to click here and we're going to remove it. You see deep to that, you have one here called the sternothyroid muscle, right? So we did first the sternohyoid, now it's the sternothyroid. And again, if we isolate it, you can see it's still attaching on the posterior surface of the sternum. And in this case, it runs up and it attaches now to our thyroid cartilage, right? Our thyroid cartilage. This is the really the only infrahyoid muscle here that we're going to look at that does not attach to the hyoid bone, right? So notice here it attaches to this thyroid cartilage and not to the hyoid bone here, but it's still considered one of these infrahyoid muscles, right? If we move laterally here, you can see this smaller one called the thyrohyoid, right? And again, just based on the name, you know it attaches to the thyroid cartilage and to the hyoid bone. If you isolate it, you can see that here. So thyroid cartilage here, hyoid bone here. And then the last one is kind of a unique one. It's a little bit different, but it is called the omohyoid, right? And it's this long muscle you see here, omohyoid. Now, this one is unique. It attaches to the hyoid like many of the others, but it's also attaching to our scapula as well. So you can kind of see it tracing it down here off to the bottom right of the screen, but it's also running deep to some of these other muscles, and then it's attaching onto our scapula. So if I isolate it, you can see that a little bit more clearly, how, again, it attaches more superiorly onto the hyoid, like many of our others, but then it's going to run down. You'll notice here in the middle of this muscle, there's a tendon. So this kind of whitish region that you see in the middle here, that's the tendon of the omohyoid, and then it has this more inferior attachment onto the scapula that you can see right down here, right? So this is omohyoid. Omo in this case is referring to like the shoulder or referring to the scapula more specifically, right? So those four muscles, again, We removed this one, but this was the sternohyoid. You have the sternothyroid, you have the thyrohyoid, and then you have your omohyoid. All of these are your infrahyoid or your strap muscles. They're acting to depress the larynx or depress the hyoid bone in many cases. But all of these are in this cervical region.